Hello, I am Dr. Dushyant Jasti, consultant neurologist and movement disorder specialist working at Star Hospitals, Banjara Hills. Today I would like to discuss about stroke, which is one of the most common leading neurological problem which contributes significantly to morbidity and mortality all across the world. Stroke is nothing but a neurological disorder which is caused either because of decreased blood flow to the brain, which we call it as ischemic stroke, or it can occur because of rupture of blood vessels within the brain, which is called as hemorrhagic stroke. As far as the data is concerned, ischemic stroke is much more common than hemorrhagic stroke. The most common risk factors which contribute to stroke are uncontrolled diabetes, uncontrolled hypertension, smoking, excessive alcohol consumption, dyslipidemia. However, there are other multiple factors which can also contribute to causation of stroke. Stroke, however, if treated adequately and in appropriate time, would significantly improve the quality of the life in the affected patient. Stroke treatment always depends upon the time when the patient has been affected. The earlier the patient comes to the hospital, the more effective treatment we can offer to the patient. In case of ischemic stroke, that is which occurs due to clot formation in the brain, the treatment options available are, if the patient comes to us within 4.5 hours after the onset of symptoms, we can thrombolize the patient either intravenous or in some cases intra-arterial also. However, if the large blood vessel which supplies the brain is getting involved, then the treatment option available would be mechanical thrombectomy, which is in fact advanced procedure which is also being done at our center, Star Hospitals, Banjara Hills, in association with intervention neuroradiologist available at our center. If the patient comes after 4.5 hours also, the treatment options would be intravenous or subcutaneous anticoagulations, antiplatelets, and thereby identifying the cause of the stroke so that we can prevent further attacks of stroke happening. In case of hemorrhagic stroke, that is which occurs due to rupture of blood vessels within the brain, the treatment options would be adequate control of blood pressure and to prevent the hematoma expansion by adequate anti-edema measures. In few cases, if the pressure rises within the brain, then we may have to do surgical therapies also in hemorrhagic stroke as well as ischemic stroke. So, I would request all the patients, especially who are at risk of stroke, to primarily get screened for the stroke risk and take necessary measures to prevent the stroke, because prevention is always better in the case of stroke. However, in unfortunate cases, once the stroke gets affected, the ideal thing is to reach the hospital, nearest hospital, where adequate facilities for intervention and surgeries are available and get treated adequately, which would improve the quality of life. We have all the facilities available at Star Hospitals, Banjara Hills, with round the clock neurologist, neurosurgeon and interventional radiologist available to take care of stroke patients 24/7. Thank you.